In this comprehensive overview, we'll explore the realm of urological conditions, which significantly affect patients' quality of life, from bladder control to sexual function. We'll cover key topics, including pathophysiology, diagnostic approaches, and evidence-based treatment strategies. By the end, you'll have a thorough understanding of these complex conditions, empowering you to deliver exceptional care to your patients. Let's begin. In Slide 2, we delve into stress incontinence, a condition often stemming from pelvic floor muscle weakness or dysfunction in the urethral sphincter. Factors like pregnancy, childbirth, obesity, or prostate surgery can contribute to this issue, resulting in involuntary urine leakage during activities like coughing, sneezing, or laughing. Diagnosis typically involves a comprehensive assessment, including urodynamic studies, to rule out other conditions. Initial management may include lifestyle changes and pelvic floor exercises, with surgical options considered if conservative measures fail. Urge incontinence stems from an overactive bladder where the detrusor muscle contracts involuntarily, triggering a sudden intense urge to urinate. This condition can arise from neurological issues like Parkinson's disease or stroke, or irritation of the bladder wall. Individuals with urge incontinence often experience abrupt urges to urinate, accompanied by leakage, increased frequency of urination, and nocturia, nighttime urination. Diagnosis typically involves a thorough evaluation, including medical history, physical examination, and possibly urodynamic testing to assess bladder function, aiding in distinguishing urge incontinence from other types like stress or overflow incontinence. Overflow incontinence arises from a physical obstruction hindering urine outflow, like benign prostatic hyperplasia, BPH, urethral strictures, or neurological disorders affecting bladder emptying. This leads to an overfilled, distended bladder beyond control. Key symptoms include involuntary urine leakage in small amounts, along with sensations of incomplete bladder emptying and a weakened urine stream. Patients may also encounter urinary retention and recurrent urinary tract infections. Diagnosis entails a comprehensive evaluation, including medical history, physical examination, and potentially imaging or urodynamic tests. Treatment primarily targets the underlying cause, such as alpha blocker medications for BPH or intermittent self-catheterization for neurogenic bladder. Benign prostatic hyperplasia, BPH, manifests as a non-cancerous enlargement of the prostate gland, leading to bladder outlet obstruction and various lower urinary tract symptoms like hesitancy, weak stream, and urinary retention. Age stands as the primary risk factor, with prevalence increasing as men age. Factors like metabolic syndrome, diabetes, and family history may also contribute. Diagnosis entails a comprehensive evaluation involving medical history, physical examination, including digital rectal exam, and potentially imaging or prostate-specific antigen, PSA testing. Urodynamic studies might gauge bladder outlet obstruction severity. Initial BPH management often incorporates lifestyle adjustments such as fluid management and pelvic floor exercises. Pharmacological treatments like alpha blockers and 5-alpha reductase inhibitors may alleviate symptoms. In severe cases, surgical interventions like transurethral resection of the prostate, TURP, may be warranted. Prostatitis, characterized by inflammation of the prostate, can stem from bacterial infections, chronic pelvic pain syndrome, or other underlying conditions. Bacterial prostatitis often aligns with urinary tract infections, while chronic prostatitis may trace back to inflammation or neurological factors. Typical symptoms encompass pelvic pain, discomfort during urination or ejaculation, and potentially fever or chills. Additionally, patients might report urinary frequency, urgency, and a sense of incomplete bladder emptying. Diagnosis entails a comprehensive evaluation, inclusive of medical history, physical examination, including digital rectal exam, and potentially laboratory tests or imaging studies. Treatment strategies may involve antibiotics for bacterial prostatitis, anti-inflammatory medications, and pelvic floor therapy for chronic prostatitis. Urinary tract infections, UTIs, stem primarily from bacterial infiltration, with Escherichia coli being the predominant culprit. These bacteria invade the urinary tract, inducing inflammation and infection in various parts, such as the bladder, urethra, or kidneys. Women face a higher UTI risk due to factors like the shorter length of their urethra and its proximity to the anus. Additional risk factors encompass sexual activity, pregnancy, diabetes, and immunosuppression. Diagnosing UTIs typically involves reviewing the patient's clinical history, conducting urinalysis, and possibly performing a urine culture to pinpoint the causative organism and guide antibiotic selection. Treatment for uncomplicated UTIs typically entails short-course antibiotic therapy. Conversely, severe or recurrent infections may necessitate longer treatment durations or prophylactic measures. Urethral strictures result from various factors like trauma, inflammation, or scarring from prior procedures. These strictures cause narrowing of the urethra, leading to urinary obstruction, retention, and an elevated risk of urinary tract infections. Symptoms of urethral strictures may include a weak or interrupted urine stream, hesitancy, straining during urination, and a feeling of incomplete bladder emptying. Severe cases might result in urinary retention or overflow incontinence. Diagnosing urethral strictures involves a thorough patient history, physical examination, and potentially imaging studies like retrograde urethroplasty. Treatment options range from urethral dilation and internal urethrotomy to more extensive surgical reconstruction, depending on the severity and location of the stricture. Kidney stones form when minerals and salts in the urine crystallize and accumulate, creating hard deposits within the kidneys. Risk factors for kidney stones include dehydration, a diet high in sodium and animal protein, obesity, and certain medical conditions like hyperparathyroidism. The hallmark symptom of kidney stones is severe, colicky pain radiating from the flank to the groin, often accompanied by hematuria, nausea, and vomiting. Diagnosis involves a comprehensive evaluation of medical history, physical examination, and imaging studies such as CT scans or ultrasound. Treatment aims to manage pain, facilitate stone passage, and prevent recurrence. This may include pain medication, increased fluid intake, and in some cases, surgical intervention. Erectile dysfunction, ED, can stem from various underlying causes, including vascular disease, neurological disorders, hormonal imbalances, psychological factors, and medications. Importantly, it can also indicate the presence of cardiovascular or metabolic conditions. Diagnosing ED involves a comprehensive assessment, including a detailed medical history, physical examination, and potentially laboratory tests to evaluate hormonal levels or other underlying conditions. Imaging studies like penile Doppler ultrasound may also be utilized. Treatment for ED often begins with lifestyle adjustments such as weight management, regular exercise, and stress reduction. Oral phosphodiesterase type 5, PDE5 inhibitors, such as sildenafil or tadalafil, are frequently prescribed as first-line pharmacological therapy. In some instances, more advanced interventions like penile injections or implants may be considered. Neurogenic bladder arises from various neurological conditions like spinal cord injuries, multiple sclerosis, Parkinson's disease, and diabetic neuropathy, disrupting the normal neural pathways controlling bladder function. Patients with neurogenic bladder may present symptoms such as urinary incontinence, urinary retention, frequent urination, and a sensation of incomplete bladder emptying, which may vary based on the underlying neurological condition. Diagnosis involves a thorough medical history, physical examination, and potentially specialized tests like urodynamic studies or imaging. Treatment typically revolves around bladder management strategies, including intermittent catheterization, anticholinergic medications, and, in certain cases, surgical interventions. Urological cancers encompass malignancies affecting the genitourinary system, with notable examples including prostate, bladder, renal cell, and testicular cancers. Prostate cancer, the most common among men, underscores the importance of early detection via screening with prostate-specific antigen (PSA) testing and digital rectal examination. Treatment options range from active surveillance to radiation therapy and radical prostatectomy, contingent upon cancer stage and grade. Bladder cancer ranks as the fourth most prevalent cancer in men and is frequently linked to smoking history. Symptoms, notably hematuria, prompt diagnosis through cystoscopy and biopsy. Treatment modalities, such as transurethral resection, intravesical therapy, or radical cystectomy, are dictated by cancer stage and type. Renal cell carcinoma, the predominant kidney cancer form, often manifests as an incidental discovery on imaging. Therapeutic approaches encompass partial or radical nephrectomy for tumor excision and targeted therapies for advanced or metastatic cases. Testicular cancer, although relatively rare, boasts high treatability, particularly when detected early. Patients typically present with painless testicular masses, warranting diagnosis through physical examination, imaging, and biopsy. Treatment encompasses surgery, chemotherapy, and/or radiation therapy.